We've all been there. You go to stand up from your desk after a long block of work, and a sudden, sharp catch in your back turns a routine movement into an ordeal. You aren't alone. Between sitting at screens all day, carrying heavy bags, and the physical tension of stress, our backs take a constant beating. When that ache sets in, we often treat the back as one giant uniform muscle. We buy a generic heat pad or try a random stretch we saw online. But because the spine is complex, these general fixes miss the specific source of the tension. Look at this diagram of the spine. The structure is divided into 4 distinct zones, and each region responds to a different approach to care. Medical experts categorize these regions as the upper back, the middle back, the lower back, and the tailbone. Identifying exactly where your pain lives on this map is the first step toward relief. Different zones are triggered by different habits, and they require localized solutions to heal. Your back pain is rarely random. It is a specific data point indicating where your daily ergonomics or lifestyle habits are placing too much strain on your frame. By matching your specific pain zone to its core cause, we identify the exact change needed to reach a pain-free outcome. The wrong approach won't resolve the underlying issue. A lower back stretch provides little relief for tension rooted in the upper neck. You are facing a choice. You can invest a minor amount of targeted daily effort into correcting the specific cause now, or ignore the root issue until it requires serious medical intervention. Lasting relief depends on how accurately you match your symptoms to the right solution. Let's look at what each zone requires. We start at the top with the thoracic zone. This is the specific area located between your shoulder blades and the base of your neck. This region is a common struggle for desk workers. Hours spent hunching forward over keyboards place sustained, unnatural stress on these upper muscles. If you have thoracic pain, you will likely feel a persistent, dull ache between your shoulders, or a sharp catch when you turn your head or move your arms quickly. Relief here depends on daily maintenance. You need to correct your posture, stretch your chest and neck, and use heat therapy to relax those muscle groups. Moving slightly downward, we find the middle back. This is the area between your lower ribs and the bottom of your rib cage. While less common, pain here heavily impacts your mobility. Middle back pain is often driven by excess body weight, poor posture, or arthritis. This combination leads to a constant burning sensation and tight muscle spasms across the ribs. Resolving issues in the upper half of your spine requires consistent ergonomic vigilance at your desk and systemic weight management to prevent chronic stiffness. Next is the lumbar region, or the lower back. This is the most common area for back pain because it serves as the primary load-bearing structure for the majority of your body weight. Because it supports so much weight, you have to protect it mechanically. Always bend your knees to lift heavy objects, and keep those objects close to your chest to maintain a safe center of gravity. When you bypass those mechanics by bending at the waist to lift or subjecting the lower back to long hours of sitting, you actively degrade the lumbar zone. Neglecting the lumbar zone can lead to herniated discs or sciatica, a sharp, stabbing pain that radiates out of the back and shoots down your legs. This cross-section shows the mechanics at play. When improperly aligned, physical pressure concentrates directly onto these lower discs. To fix this, you must shift the load. Core strengthening builds abdominal and back muscles to support the spine, alongside using ergonomic chairs. The trade-off for lower back health is a commitment to strength and therapy. Without it, you risk conditions that can limit your mobility for years. Finally, we reach the very base of the spine, the tailbone. Pain here is medically referred to as coccydynia. Coccydynia is triggered by highly specific physical factors. It often stems from sitting on hard surfaces for too long, childbirth, or direct trauma like falling backward. The defining symptom is localized pain at the base of the spine that peaks when you transition from a seated position to standing up. Treating it requires changing your environment. You should limit how long you sit continuously and use ice or heat to manage inflammation. You may also need specialized supports, like a cushion with a cutout, to remove pressure from the coccyx while you work. Resolving tailbone pain requires minor workspace modifications and specialized cushions, which can provide immediate relief during your daily movements. Stretching and cushions are effective for routine strain. However, there is a clear threshold where home care is no longer sufficient and professional help is required. Look at this symptom map. It separates routine biomechanical pain from severe medical emergencies requiring an immediate doctor's visit. Seek help if your back pain lasts more than a few weeks or if pain spreads down your legs. You should also see a doctor if you experience a fever alongside your back pain or notice sudden weakness, numbness, or tingling. Any sudden loss of bladder or bowel control is an absolute medical emergency. If you experience any of these symptoms, stop trying to manage the pain at home and head directly to a medical facility. Ignoring these red flags risks turning a manageable habit correction into an urgent medical situation. Your back isn't a single unit. Your specific pain zone tells you exactly which lifestyle fix you need. To stay proactive, maintain a healthy weight to reduce the load on your spine. Stay flexible with yoga or swimming, and always bend your knees when you lift. If you work at a desk, avoid slouching, keep your ears aligned over your shoulders, and invest in an ergonomic chair that supports your lower back. If your symptoms have crossed the line into those medical red flags, you need professional diagnostics. For residents in Bangalore, Arka Anugraha Hospital in JP Nagar provides specialized care for these issues. Their 24/7 facility has multidisciplinary teams in orthopedics and emergency care to diagnose and treat complex spinal failures with precision. Taking control of your back health means acting decisively. Match the right localized habit change to your specific zone today, before minor aches become major hospital visits.